जब आंतड़ी बाहर आती है एक सुराख से, जो सुराख बॉडी में किधर भी हो सकता है, उसको बोलते हैं हर्निया. हर्निया इन चिल्ड्रन, if it gets blocked, it will cause life-threatening problem. So intestine will get blocked, and it's a danger to the child's life.
You are watching Surgery Simplified, Shastrakala Saral Shabdo mein.
Shastrakala Saral Shabdomein. Hello doctor, welcome.
Hello, नमस्ते.
डॉक्टर मैं आपका एक्चुअली वो बुक जो है वो देख रही थी, उसमें काफ़ी सारे सर्जिकल सिम्टम्स के बारे में एक्सप्लेन किया हुआ है, तो आई वांटेड टू नो कि आज आप कौन से सर्जिकल सिम्टम के बारे में बात कर रहे हैं.
हाँ, तो बेसिकली एज वी हैव डिसाइडेड कि जो कॉमनली जो सिम्टम्स रहते हैं, बिकॉज अभी आई हैव बीन प्रैक्टिसिंग अराउंड 40 years, so I find that there are certain symptoms which are more common than others. We have already discussed 3 of them which are related to passing stools. Now we'll discuss swelling or of the scrotum. Scrotum means testes in males. Now this swelling of the scrotum again is a common symptom in male children and in adults.
Okay, there's no age bracket as such.
There is. It is common in children and in adults.
Adults as to maybe.
As in school going, college going,
Okay.
all kinds.
Okay.
So it's a very common symptom in adults. It's one of the common symptoms for which males consult surgeons or the parents of a male child consult surgeons. So let's, like last time, start with what is the causes of swelling of the scrotum in children.
Okay.
Because the causes are different in children and they are different in adults. So in children, swelling of the scrotum, the only thing we need to ask the parent is, does this swelling change in size?
Acha.
Okay. If the swelling changes in size, that means it becomes small sometimes and big, especially when the child cries, it is more likely to be hernia. Okay. And if the swelling does not change appreciably in size, it is more likely to be hydrocele. Now what is this? What is hernia and what is hydrocele? Hernia is when there is the passage of an intestine loop, a loop of intestine through an opening in the body. That is hernia. Okay.
Can you repeat that for us once again?
Whenever there is a protrusion or passage of a loop of intestine, जब आंतड़ी बाहर आती है एक सुराख से, जो सुराख बॉडी में किधर भी हो सकता है, उसको बोलते हैं हर्निया. तो इन मेल चाइल्ड व्हाट हैपेंस इज द टेस्टिस are in the abdomen up to the 7th month. Okay, between the 7th month and when the child is born, the testes descend down. So the testes in a male child are in the abdomen, inside here. Okay, and as the child grows between the 7th month till delivery time, the testes come down and enter the scrotum. Obviously there is a hole through which these testes have to come out and come in the scrotum. This hole gets closed off in most people. In some it doesn't get closed. If it remains open, now through that the intestine can come out and form a hernia. So it will come out and come into the scrotum, and it will appear as if it's a swelling of the scrotum. But when the child cries, the intestine comes out. When it's not crying, it goes back in. That's why there's a change in the size. Now the important thing is, if it is a hernia, it will need to be operated at whatever age you diagnose it. Whether it's 1 month, 2 months, 3 months, doesn't matter. Because a hernia in children, if it gets blocked, it will cause life-threatening problem. So intestine will get blocked and it's a danger to the child's life. It has to be operated.
So you spoke about when the child cries, it enlarges.
No, the intestine, because of the pressure in the abdomen, the intestine goes through that hole and comes into the scrotum.
Okay, so crying is kind of a mood or an emotion. Is there any other emotion?
No. It's just crying. So the child cries when it is hungry, when it is wet, it cries. When it cries, it comes out. Okay. Now, suppose the hole is not big enough for the intestine to come out, but there is some fluid in our abdomen always, which is to lubricate the movement of the intestine. That fluid comes out. That becomes a hydrocele. So there is some fluid in our abdominal cavity. It lubricates the movement of the intestine. If that fluid comes out, it becomes a hydrocele. So only looking at, we cannot make out it's a hernia hydrocele, but we get a fairly good idea. When I examine the child and if I can press and the intestine goes in, I know it's a hernia. Okay. However, the confirmation is by doing an ultrasound. If you do an ultrasound exam, you will know if it's a hernia or hydrocele. If it is a hydrocele, there is no need of surgery, at least till the child is 2 years old. Very often, the hydrocele will get cured on its own. So you can wait till 2 years. However, it's a hernia, it needs surgery immediately. It's a small surgery, small opening made here, and the hernial hole is closed. Now let us come to adults. In adults, we have 3 conditions which can cause swelling of the scrotum. One is, the most common is hydrocele in adults. The second is a hernia, which is like in a child is coming right down, which is called as a complete hernia, because hernia can be even incomplete. It can come only till the groin and not enter the scrotum in adults. It is more common in children to have a complete hernia. But in adults, the hernia will come only up to the groin in most people. In some, it will come right up to the scrotum. Okay, so that's the second cause. And the third, in young adults, in the age group between 17 and 30, a testicular tumor is the third cause, which can come as a scrotal swelling. And the fourth is epididymal cyst. Above the testes is the epididymis, from where the vas deferens opens up. जो नस रहता है, जहाँ से धातु निकल के बाहर आता है, that is called epididymis. उसकी अगर गांठ हो गई, तो भी वो it will appear like a scrotal swelling. It is rare. So, what is important is examination. So, if you examine, you will find that it is fluid and it is not getting, you can't push it back. So, it's hydrocele. If you are able to push it back and the swelling goes away completely, it is hernia.
Okay.
And now, between a tumor and hydrocele, it is difficult clinically to be sure what is it. Okay. So, ultrasound if you do, you will know whether it is a testicular tumor or it is a hydrocele which is fluid around the testes. So, if it is a hernia, it will need surgery. We will cover it with other hernias.
Right.
If it is a hydrocele and if it is a large hydrocele, then there are 2 things that hydrocele do. One, if the boy is in the age group where he is sexually active, it will impede or it will come in the way of performing sexual act, especially if the hydrocele is big.
Right.
The second thing is, any fluid anywhere can always get infected.
Right.
So, you should operate. The third thing is that when there is a very large amount of fluid, the pressure on the testicles can cause the testes not to function optimally. It can interfere with the semen, that is sperm production.
Right.
Okay, semen or not semen but sperm production. So, the need to do hydrocele surgery is A, because it is very large and it sometimes comes in the way of walking or performing normal activity. It interferes with sperm production and it can be prone to infection. The surgery is very simple. It can be done under local or spinal anesthesia. You open it, drain the fluid, and you can remove the sac which is enlarged, or you can turn the sac and suture it so that there is no sac, there is no hydrocele. You should not only do aspiration of fluid, because when you do aspiration, you can introduce infection and convert a non-infected hydrocele into a bag of pus,
Right.
which is not good. So you should not put a needle. If it is a testicular tumor, then we need to first do certain blood tests, because there are 2 types of testicular tumors. One is called of the seminiferous tubules, which is called seminoma,
Okay.
The term is seminoma. The other is teratoma. These are the two. Teratoma, seminoma. Okay. So teratoma will give a certain tumor marker, that is a certain test which is a hormone which is produced by this kind of tumor which will increase in the blood, and seminoma which will also produce a certain tumor marker. It is called alpha fetoprotein, and this is called HCG, human chorionic chromatoprotein, increases with teratoma. Alpha fetoprotein increases in seminoma. If you do the blood test, you will be able to know which of them it is.
And this is only common among
young male adult. The treatment is do what is called as a removal of the testes. It is called high orchidectomy. That means along with the cord, you remove it from here. You don't remove it from below. Hydrocele is done by incising the scrotum, but in case of testicular tumor, you have to incise like a hernia, bring the scrotum out, clamp the cord and remove it along with the cord. So it is called high orchidectomy. Then you send it for biopsy. Seminoma needs a particular different type of treatment which is more towards radiotherapy, and the teratoma is more towards chemotherapy.
Acha, okay.
If you know one of the most famous cricketer, Yuvraj Singh.
Acha,
Yuvraj Singh suffered from testicular tumor. He had a teratoma, and he actually had it had already spread into his chest. And he underwent chemotherapy and he recovered completely.
Okay.
Right, and he was having that when he played the 2011 World Cup which we won, and he became the man of series. So imagine the amount of dedication that man has for cricket and India. I mean, he was suffering from this problem, but he didn't tell anybody, and he continued to play and became the man of the series, ensured that India wins the World Cup. And he's now become a brand ambassador for cancer survivors.
Understood.
So you don't have to lose hope.
Right,
Cancers are there, but they are treatable. Eminently treatable cancer is testicular tumors. They are eminently treatable.
So among adults, what is the earliest that it can be detected?
As soon as you find that you got a swelling in the scrotum.
Swelling.
Again, as I said, the take-home message is, if you find that your scrotum is increasing in size, it's best to go to a surgeon. Let him decide whether you have a hernia, whether you have hydrocele, whether you have a testicular tumor. Whatever it is, the earlier it is treated, the outcome is always better.
Got it. All right. Thank you so much, doctor.
Okay.
All right, viewers, this was another very informative episode about scrotal swelling. Okay. All right. Thank you so much, doctor.
Okay.
If you like our informative video, please hit the like button, subscribe and share, and hit the bell icon for notification. अगर आपके पास कोई दूसरे topics हैं which you think that doctor should make a video on, but please let us know in the comment section. एंड इस वीडियो के बारे में अगर आपके कोई विचार है या कमेंट्स है या क्वेश्चंस है, वो भी आप कमेंट सेक्शन में डाल सकते हैं. सो स्टे ट्यून्ड फॉर मोर वीडियोस एंड थैंक यू.